Hi, I'd like to welcome you to our neurometabolic video series. My name is Dr. Sean Price and I'm Clinical Director here at Chiro Spa in Fort Walton Beach, Florida. The topic of today's video is thyroid metabolism. Now, we have a lot of patients that come into our office who are experiencing symptoms of thyroid issues, symptoms like inability to lose weight, being cold all the time, changes in their hair texture, losing hair, fatigue, brain fog, all kinds of different symptoms that could be associated to the thyroid gland. A lot of these patients, when they come in to see us, have already been to see their physician. They've already had some lab work done, and their lab work either came back normal, or maybe it came back abnormal and they're even on medication for the thyroid gland, but they're not feeling any better. So the purpose of today's video is to help you understand, number one, what those lab values are measuring so that you know what might be going on with you, but number two, to help you understand why you may not be feeling better even though your lab normals are, or your lab values are back into a normal range. Okay? So let's start at the very beginning. Your brain controls all of the functions in the human body. That includes the thyroid gland. That includes every function that happens in the human body. So we're going to start with what's going on in the brain in the thyroid metabolism. The hypothalamus is located in the brain, and the hypothalamus tells the pituitary, hey, there's a need for these thyroid hormones because there aren't enough in the body, because the hypothalamus actually senses these thyroid hormones. So if the thyroid hormones in the blood are too low, then the hypothalamus is going to say, hey, Mr. Pituitary, I need you to tell the thyroid gland that we need more of these thyroid hormones. So the hypothalamus will send a substance called thyroid releasing hormone to the pituitary gland. The pituitary gland then sends a substance called thyroid stimulating hormone to the thyroid gland. Now, thyroid stimulating hormone is the test that is typically run to see if your thyroid is functioning okay. Now, here's something that's critical to understand. If your thyroid is hypo, which means it's under functioning, then this TSH level will be high on your lab tests. If your thyroid gland is hyper, which means it's over functioning, then your TSH on your lab test will be low, out of the normal range. Okay? That confuses some patients and they don't really understand why. So the reason behind this is, as I said a minute ago, the hypothalamus gland senses these thyroid hormones in your blood. If there are not enough thyroid hormones in the blood, then the hypothalamus gland wants more of that stuff to be released. So it increases the release of this TSH. So your TSH level goes up. Well, if your T3 levels are chronically low in the blood and your T4 levels are chronically low in the blood, then it keeps trying to make more and make more so that TSH level stays elevated. So that's why elevated TSH levels will cause the thyroid gland, or elevated TSH levels indicate hypothyroid or low functioning thyroid. Now here's the key. What the hypothalamus picks up on is T4. That's one of the main things that it picks up on. So if you go to the doctor and they run your TSH levels and your TSH level comes back high and you're hypothyroid, then what they may do is put you on either Armour or Synthroid or levothyroxine or something along those lines, some kind of a thyroid hormone medication that will help to raise the levels of this T4. So then therefore the hypothalamus gland picks up on the fact that there's enough T4 in the body, so it tells the pituitary gland, hey, you know, we're good here, we don't need too much. So then your lab values start to go back into a normal range. Okay, now this is critical to understand. This is where a lot of patients will go to their doctor, they will get this thyroid hormone, their TSH levels will come into normal, but they still don't feel better. In our next video series, I'm going to explain to you 6 different patterns of thyroid dysfunction, and only one of those patterns are truly helped by by T4 supplementation through thyroid hormones, medical medicines. So we'll get into that a little bit in the next video series, but that's an important factor to understand, that a lot of times people will go to the doctor, they will get on the proper medication, that medication will bring their TSH levels into normal, but they still don't feel better. Okay, so why does that happen? And let me interject a little bit something here. I'm not here to tell you to get off your medications. My goal is not to take you off your medications. My goal is to help you recover your function and help you get back to optimal functionality in your body so that your body can function and use what it's got and help you feel better and help you maintain that vitality in your life and get rid of those thyroid symptoms. So I want to make very clear, do not go and jump off your medications. Medication conversations need to happen between you and your primary care provider. Okay, so the thyroid gland, when the thyroid stimulating hormone is released, then the thyroid gland then releases T3 and T4. Now, T3 is the active thyroid hormone that the body uses. That's what the body actually functionally uses to get the desired result. T4 is an inactive thyroid hormone. So something needs to happen to this T4, because you can see here, the thyroid only produces 7% of T3. The remaining 93% that's produced by the thyroid gland is T4. So that T4 needs to be converted. It needs to be basically converted into T3 so that the body can use it. So what happens here? There's a substance in the body called thyroid binding globulin. The TBG will come in and it'll pick up this T3. It's like little taxi cabs. It'll pick up this T4 and it'll take that taxi and it'll drive it over to either the liver, the gastrointestinal tract, or your digestive tract, or into the peripheral tissues such as your muscle. And its taxi cabs will take that T4 to those tissues, and the tissues will get out, they'll go into these organ systems, and then that's where the conversion happens for the rest of that T3 to come out. About 60% of the T3 is produced in the liver, 20% of the T3 is produced in the GI tract, and the remaining 20% is produced in the peripheral tissue, again, such as the muscle. Okay, so here's what's key to understand. If you're on the medication and your TSH is at normal level, that's because your body is registering, your hypothalamus gland is registering that there's a normal range of T4 in the blood. Now, you may still be feeling poorly. Well, if you're still feeling poorly, why is that? Well, this T4 needs to be converted into T3 so that the body can use it. So there's something that's not happening correctly from this point with all of this. Okay, because the T4 needs to be delivered to those tissues in the body so that it can be converted to T3 so that we can use it. So if you have a liver issue, if your liver is toxic or if it's not functioning right and it's not converting that T4 to the T3, then you're not going to have enough of that T3 in there and you're still going to have symptoms. If your GI tract is not functioning properly, if you have chronic gastric inflammation, if you've got food allergies, if you've got leaky gut syndrome, if you've got some of these things going on, then that conversion is not going to happen in the GI tract. And if your peripheral tissues are not functioning properly, then you're going to have a lack of that T3 because it's not going to be converted properly. So this is where a lot of the challenges happen, but these cannot be addressed by the traditional medical model of supplying levothyroxine and Synthroid for the supplementation of the T4. Now, I hope that makes sense. It can be a little bit confusing, and I hope that makes sense. I think tomorrow or in the next video, when we go over the thyroid patterns, this might make a little more sense to you. Okay? I want to end this video by reminding you that health is not merely the absence of a disease or infirmity. Health is actually optimal functioning, both physically and mentally, as well as socially in your body. And you cannot rebuild health one day, 1 week, or even 1 month at a time. You most certainly cannot rebuild health one miracle pill, one miracle exercise program, or even one miracle fad diet at a time. You can, however, begin to rebuild your health and actually reinvent your life by following a customized program that helps you learn what the right choices are for you and your body, and making those right choices one decision at a time. My name is Dr. Sean Price. Have a great day.